Hi, it's Dr. Ingalls from WeCare Frisco. I'm honored to be joined by Dr. Craig Keuchel, a chiropractor and movement specialist based in Plano, Texas, at the treatment room. Dr. Keuchel, thank you so much for being here. How would you describe your approach to treating pain compared to more traditional chiropractic or passive care models?
I try not to be passive. I try to be pretty active. I got into this because I like to be hands-on. I like to work and to do different things, and so I want to find different ways for you to start to move sooner. So that's basically the biggest difference is my exams and audit and checkpoints are always going to be more functional and more activity driven versus whatever assessment I'm doing in the office. Like the range of motion is awesome. We definitely want to make sure we maintain that and maximize that. We want to make sure that we actually get you towards whatever activity you want.
Are you mainly seeing athletes or everyday people dealing with chronic pain or injuries?
I'm seeing everyone. My personal philosophy is that everyone is an athlete in their own way. So we want to make sure that we're getting our body to move and to function how we need to for whatever it is that we're doing. So whether it's actually an athlete who's competing, say, versus the person who's trying to take care of their child, everybody moves the same way and it responds the same way. So if we can break it down into whatever avenue you're in, that's how I can gamify the treatment and make everything to have more of a lasting impact and be more specific to whatever you're going through.
And what types of patients tend to get the best results with your approach?
Those who are willing to push the envelope. So we work hard in the office to improve your range of motion, improve the soft tissue's ability to move, improve joint range of motion. But the only way for that to really stick is to actually go out and use it. So whether it's a couple exercises that I think would benefit you outside the office, or going back into your sport, or just walking, or doing different things to load your body and keep moving what we worked on, those are the people that respond the best.
So, can you explain what would a first visit look like for a patient coming to see you?
So every single visit is going to have some sort of manual work involved. I'm really going to be very like regionally specific and really do my best to explain how this is all working into like your main complaint. So a lot of times people come in with saying they have like a back injury or a shoulder injury or a hip injury, which may or may not be true, but the actual main problem is actually over here, and I'm going to treat it by working on this tissue and this tissue to actually get that problem to resolve. They come in, I'm going to start do my assessment exam, and we'll start doing some manual work. I want to see how the tissue's responding, see how it's doing. And sometimes that's as far as we go in the first visit because I just want to see how it responds before I incorporate anything else into it. Because I don't want to do too much and not really know what worked. I want you to understand what's happening. But then from there, I do have different things that I will layer in and things that have responded very, very well to certain conditions. I am a chiropractor, so there is adjusting that happens. I like to use my adjusting more towards what uh, the research shows it to be, more pain relief and increasing motion. So I'm not going to adjust you and say that like you're fixed and good to go. I think the muscles play a bigger uh, component of that. The adjustment can really desensitize certain areas, get a lot of motion very quickly, and allow you to get more into exercises and different movements that we need to actually progress your condition and get you back to doing what you want to do. So manual work pretty much always, depending on what's going on. Shockwave is very consistently involved, and then needling is mixed in, adjustments are mixed in, and then I'm always going to kind of do a little mini re-exam each visit and do my best to get you hopefully feeling really good so we can get out of the initial injury typically within 2 to 3 weeks, depending on what's going on. And then after that, it's more of whatever you feel like you're trying to get to, and whatever I feel like might set you up for better success in the future.
WeCare Frisco will be partnering with Dr. Keichel's clinic for two pop-up events in the treatment room in Plano on Friday, June 26th from 12 to 3, and then he'll be at WeCare Frisco on Saturday, June 27th from 9 to 12. Each 20-minute session is $40 and will include a quick assessment and an introductory hands-on treatment approach appropriate for your specific injury or symptom. So if you want to register for a session with him, click on the link below to reserve your spot. I hope to see you at one of these pop-up events.